Can we let people in?
Yeah.
Because we're subject, so we need to let people in.
Even if they hear us chatting.
Yeah, we just say 30 seconds.
Je peux pas. Ok, je vais trouver la solution. It's okay. Let's start.
You ready to go?
Yeah, we are good.
Oh, we've got people in. Great.
Ready?
Yeah.
Good.
Can you take the thing off the screen?
Can you take the allow recording off the screen? Cyril, please, on the screen.
No, but someone needs to allow me to read.
Thank you.
Okay, good morning, good afternoon, good evening. Thank you for joining us today as part of the ICN delegation to the 76th World Health Assembly. We apologize for being a little bit late on our start, but we are so glad that you have joined us. The 76th Assembly's theme is Saving Lives, Driving Health for All, and hopefully you've had a chance to go over some of the information in advance, and you'll be hearing lots more detail and getting some great information about the interventions that ICN is going to be doing over the next couple of days. And as many of you know, ICN has had a special relationship with the World Health Organization since its creation. And so we've been making interventions for the past 75 years. We've also lobbied for nurses to be part of their delegation to the World Health Assembly, and we hope that many of you listening are members in your delegation. We know this year that's been critically important because the number of individuals who've been allowed to enter the assembly has been limited due to constrained space at the Palais. Now, we also know that things have changed a lot since our relationship started with the World Health Organization, and as they celebrate their 75th year in existence, we have been an important part of that as well. As you join us virtually, we want to be sure that your participation is as robust as possible. So again, we encourage you to be active in following the issues, in bringing your voice to your delegation virtually, as well as to our delegation, and making sure that if you have specific suggestions that you share them with us as well. The process for the reports and the eventual adoption of agreements that come throughout the World Health Association meeting are informed by all of the groups such as ICN. Now, I'd like to next introduce Erica Burton, who's a senior advisor and consultant in our Nursing and Health Policy Group. She is our main person who takes care of all the details, keeps us on track, helps everyone understand what the lay of the land is, because the WHA can be a very complex meeting. And so she is our master, and she's also going then to introduce her other colleague in our nursing group. So I'm going to switch places with Erica as she goes on to share the details.
Thanks so much, Pam. Hi, everyone. It's so nice to be here. I haven't been in Geneva for at least 4 years. So it's wonderful to be amongst colleagues and back in the city. Some of you might know me from previous WHAs. For those of you who are new to WHA, welcome. As Pam said, I am a nurse consultant and previously the senior policy advisor at ICN. It's my absolute pleasure to lead the WHA delegation activities throughout the week. I guess it's a week and a half this year. I wish that we were all together in person. Unfortunately, with some construction going on at the Palais, we're able to only be 6 of us. So we have a really strong core delegation of 6 here on the ground in Geneva this year. And then we have almost 80 of you joining.
8 d'entre vous donc sont connectés d'un peu partout dans le monde.
Virtual. Para aquellos que no hayan participado en otras asambleas, les quiero
how to navigate the website, where the documents can be located, and sort of to help you navigate through your participation in the next 10 days. I'm just going to share my screen. It's work. It doesn't give me the button anymore. Let me see. Got it. Yeah, got it. Okay. Okay. So, welcome everybody. The WHA actually opened yesterday. It opened at 2 p.m. And it closes May 30th. But the real good stuff on the agenda, there we go, starts today. And so, as most of you know, the WHA is WHO's highest decision-making body. It sets out the organization's policy and it approves its budget. There's 194 member states who attend each year, and it's open to member states, associate members, observers, and then, of course, non-state actors. So ICN has been in official relations with the WHO, as Pam mentioned, as one of the first non-state actors. This year, the theme is WHO 75, Saving Lives, Driving Health for All. So the first thing to know about is the WHA main page. I did share in the welcome email the link to this page, so I hope that you've all been able to navigate around and explore the documents. I will take you there now, and so you can see. So the main page looks like this. Where you'll find the live recordings are all on the side here. So important to know that the meetings are separated by committees. So we have Committee A, which is where most of the important agenda items will be discussed. And then we have Committee B. If you click on the live button, it'll bring you to what's live now. So for example, the plenary is taking place shortly, and that'll be what's playing. If you click on Committee A and B, it'll show you either something that's happening live in that room, when it's going to be live next, or as you'll see throughout the week, it'll start to compile pre-recorded sessions. So if you missed a session or if you're on the wrong time zone, then they'll be listed here and you can click back and access it there. There are also the plenary sessions. So if you click on plenary, again, you'll see the first plenary meeting happened yesterday. So if we were to click on that, we could go back and watch that. Currently, it is live. We are in the plenary. And so you could click on that to watch the plenary session. There is interpretation in English, French, Spanish, Cantonese, Arabic, and Russian. So the next page that you'll want to know about is the WHO documents. So if you scroll down here, click on the WHA documents. If you just save this page, you'll be able to flip back and forth between the live webcast down here on the right-hand corner and all of the documents. The main documents can be located in a few different places. They are all on this main page, and as resolutions start to come up and decisions start to come up, or conference papers that are added throughout the week, they'll also be added down below. The other way that you can access the documents are through clicking on this first document here, provisional agenda, and that is a clickable agenda. So that is organized in order, in agenda item order numerically. And then you can click on that and it brings you right to the document. So there's a few ways that you can go find these documents. And you'll see that I will be sending in a few hours your delegation pack. We will have links to all of those documents as well. And I'll explain that just in a few minutes. The other important thing that you need to know about is the journal. So the journal is updated every morning. And as some of you may know, the agenda doesn't always follow a sequence as it's first reported. So you might wake up and access this journal and see that the agenda item that you want to follow has actually been moved to later in the afternoon or to another day. So I recommend constantly checking this journal. They do update it, and they can be found on this left-hand column here. So if we click on that for today, you can see that right now the plenary meeting started at 6 p.m.
Just ask people to mute.
Oh, yeah. If you're not already muted, if you would kindly do so, that would be great. And then so it goes through the date and the working hours. And then it gives you the program of work for the day. So if you scroll down here, you'll see that the opening of by Dr. Tedros is this morning at around 10 a.m. So just after our welcome meeting closes. And that will be the close of the plenary. Then we'll have the very first meeting and the opening of Committee A. And that's when we start to talk about the agenda items. The first one is item 12, and ICN has a statement on that. And we'll talk a little bit about that in a second. Lastly are the strategic roundtables. Let's just see if it'll let me open this here. Wonderful. So there are strategic roundtables, which are delegates, WHO experts, partner agencies, civil society, and non-state actors. And the sessions will take place starting today and until the 27th. So today until Saturday. And there'll be webcast here as well. Again, some interpretation is available, and you'll just get to come to this page and click the link. I will resend another email with all of these links so you can easily access those. But as the days go by, I'm sure you'll be able to navigate smoothly around this site. At the end of this session, we will have an opportunity for delegates to ask questions. If you want to pop them in the chat or write them down, if you have any questions about that, anything that I've said, you can put those in the chat. If we run out of time, I am available by email all week long. We also have our WhatsApp group. So I did send out the link if you join that. It's a really great place to connect with your colleagues, to discuss what's going on at the WHA, if you've missed something, to share photos. So I encourage you to join that as well. Now we're going to hear from our colleague Hoishan. Hoishan is expecting her first child, so she's not here this morning. She has helped enormously in the preparation of all of the information that you'll be receiving over the next few days, and you will likely see her on camera in pictures. I hope that she will be able to join me. But Hoishan was going to present the ICN delegate pack. I'll do that now. We've prepared this pack, and it is a rich resource. It has all of the briefings for all of the important agenda items that are relevant to nurses and nursing. And so it starts off, you'll be receiving this in the next few hours. I wanted to present it and explain it before handing it over. It starts off with a background. So just to give you a little bit of a sense of what the agenda item is on, some of the historical information on resolutions that have been passed around the topic, and some facts in certain ones. And then it goes on to describe the World Health Assembly action. So when the report is written up, the executive board typically asks the World Health Assembly to either note the report or to adopt a resolution or a decision, or ask it specific questions to help it guide its discussion. And so we've compiled all of those actions. You'll see if you've navigated around the WHA website and you're looking at all the documents, some can be 30 pages long. They're kind of complicated if you haven't used them before. So we just wanted it all to be in one spot, and for you to have a quick reference to go back when you're following the decision. After that, you'll see ICN key messages. So these are our key points For nursing colleagues who are here in Geneva, these are points that we can help guide their interventions and points to help think about the discussion in the context of nursing and nurses. So you'll see this is a long.
Sorry, I think we lost your audio. I can't hear you.
Yeah, we lost the voice.
Colleagues, some of you have, I think, have got open mics. So if it's, or have we lost the connection?
Oh, Shanna's there too.
Colleagues, if you've got open mics, you just check that you're on mute, please, because we are hearing some of you. Put questions in the Q&A, and we will come to those of course.
Thank you. Thank you. And I see Hoi Shan actually up on the screen. Hoi Shan, no pressure, but did you want to take over and just describe our statements?
Yeah, absolutely.
Okay,
Can you hear me well?
Wonderful, we can. Thank
Perfect.
you.
Yeah, so hi everyone, welcome to the webinar. And so in this session, I'm going to briefly tell you about ICN statement and also the key discussion in this year World Health Assembly. So as Erica mentioned, at the World Health Assembly, World Health Assembly is the WHO plenary organs, and its members are highly qualified, expert in the field of health, and also preferably representing the relevant national body, usually the health ministry. And so it's within the discussion in the World Health Assembly, usually the WHO collaborates and cooperates closely with the states. Member state will submit annual report to the WHO on new measures to have adopted and progress they have achieved in improving the health of their populations. And also WHA is a good occasion to cooperate with the non-governmental organizations. The organization can establish official relations like International Council of Nurses, ICN, with the WHO, and we can deliver our interventions on particular agenda items. And so this year, the sessions of World Health Assembly will determine there are some key discussions in the 76th World Health Assembly. And in this year, key discussions and decisions are expected on a review on the WHO work in health emergency, including the international health regulations and strengthening the WHO preparedness for and respond to health emergency, and also on the strategic and global actions on areas such as women's, children's, and adolescent health, rehabilitation, universal health coverage, and primary health care, traditional medicines, infection prevention and control, and also health of refugees and migrants, and non-communicable diseases, mental health, and social determinants of health, etc. And other important items that will be discussed in the next few days is the approval of the WHO program budget for 2024 to 2025, including the decision to increase access contributions and other matters coming from the working group on sustainable financing. So regarding ICN statements, we will intervene on 6 agenda items. So the first one is agenda item 12.
Premier est le point 12, la stratégie mondiale pour les
las directrices generales para la salud 2030. And the second item is 13.1, universal health coverage. And the third one that we're going to intervene on is 13.2, political declaration of the high-level meeting of General Assembly on the prevention and control of NCDs and mental health. And this is a constituency statement that we will be working with the NCD Alliance. And the fourth agenda item that we're going to intervene on is on the draft global strategic on infection prevention and control. And the fifth one is the strengthening WHO preparedness for and respond to health emergency. And this is also a constituency statement that we are working with other partners, particularly in the World Health Profession Alliance. And the last two agenda items that we will intervene on are the Global Health for Peace Initiative, item 15.3 and 16.1, Wellbeing and Health Promotion. So as I've mentioned, there are two types of statements that we can intervene on or we can deliver and submit to the WHO Secretariat. First one is the individual statement, and the second one is a constituency statement. So what's the difference between the two statements? So basically, at the beginning of before the World Health Assembly start, the Secretary selected a limited number of agenda items for constituency statement, and it is based on an assessment on which items are more likely to attract the most interest for statement by non-state actors. So this year, the Secretary have selected a few for the constituency statement, including the items 13.2 on NCDs and mental health, and 15.1 on WHO preparedness for and response to health emergency. And under those agenda items, maximums of 4 constituency statements can be selected for debate and be discussed at the meeting. And only non-state actors in official relations can join the constituency statement for discussion. And another key difference between the two statements is that the length of is about the length of the statement. So for individual statement, it's much shorter. Usually we have about 1 minute for delivering the statements, about 130 words to submit. And for constituency statement, we have the same length as the statement by member state. We have approximately 330 words for 3 minutes. And you can find both statements on the WHA statement website. So it's also a web page that open to all. So I would highly encourage you to have a look at the web page because you can find not only ICN statement, but also statement from the member state, from other non-state actors as well. Yeah, so as Erica mentioned, you can also find ICN statements on the ICN webpage. I think we will have the statements in 3 languages as well. So that's a brief introductions of ICN statements and what we plan to do in the next about 10 days for the interventions. So I will now pass the floor to Howard for ICN key messages. Thank you.
Thanks so much, Hoshan. A lot of information, and again,
we've lost the concept.
We lost the.
No, we can hear you.
You can hear me? Everyone can hear me okay?
Yeah, we can hear you.
Fantastic. Thanks, Hoshan. Fantastic. And again, these the ICN delegate pack with all of the statements, constituency and individual, will be sent to you just shortly after this meeting. So you'll have those in your hands. We will also put in the WhatsApp group when we're about to deliver a statement. So if you're not by your computer, you can log in and follow along. I will hand over back to Pam just briefly before Howard gives his key messages.
Yeah, thank you, Erica and Hoshan. Appreciate all of the hard work going into pulling all of this together. And as you receive the materials shortly, again, there'll be a lot of great information. I wanted to just reinforce some of the things that we've been working on intently. And you've heard some of these major items be raised in terms of the interventions that we're going to be making. First is that, both at the international as well as national level, we've been talking about universal health coverage and rebuilding and strengthening our health systems. And as you can see, that is one of the primary areas of focus. Rebuilding and strengthening our systems is really grounded on achieving universal health coverage. And part of that is increasing the workforce, strengthening the workforce, and making sure we're able to deliver more primary care. So we've been identifying that as a major issue, along with being sure that we are addressing the challenges to the scope of practice for nurses and being sure that we are encouraging full practice to the extent of every individual's education and roles so that we can not only provide additional access to care, but make sure we are optimizing roles. Now, I've had the privilege of working on the UHC 2030 task force that issued the for UHC. I see. Here. I wanted to let you know that at the recent G7 Health Ministers meeting, ICN presented a joint statement with the Japanese Nursing Association to call for commitment and support to nurses and healthcare workers worldwide in order to achieve UHC. That was very well received. And also coming out of the Health Ministers meeting was a restatement, if you will, of the UHC 2030 action agenda. One of the most important action items for us is the one on the supporting the health workforce. And throughout the process of bringing that report forward, it was very clear that everyone supports the need to have a workforce that is healthy to be able to deliver UHC, or all the other aspects will fall apart. So we're very proud of the work that we've been able to contribute to that. Now, I also want to remind you last week that we released our Charter for Change with 10 actions that we believe are important policy directions that governments can take, as well as our employers, to sustain and strengthen their health systems, because we want them to be safe, affordable, accessible, responsive, and resilient. Without that, we can provide the work environment that will not only retain, but continue to attract workers. Now, and then we remind you too, as that was a way to also expand our interest in the International Nurses Day theme of Our Nurses, Our Future, that we continue to call on actions that will value, protect, respect, and invest in nursing. So bring these messages forward in your deliberations as part of our delegation. And if there are, again, really important messages that you also hear that need to come back to us, we hope you'll share them with Erica in the days to come. So Howard, over to you.
Thanks very much, Madam President. Good morning, good afternoon, good evening, everyone. Firstly, let me give my thanks to all of you for agreeing to participate as part of our virtual delegation. Our delegation in total is about 80 of you. Those of us who are physically here in person and those of you who are joining us from right the way around the world. I think we have all of the regions covered off as well. So as Erica said, we wish we could have had more people here in Geneva, but regardless, we've got a very strong nursing presence across the agenda. Erica and Hoishan, I also want to express my thanks for the work that they have done. You will get the delegate pack that they've both spoken about very shortly after this meeting. What we've gone through so far is the business of WHO, of the meeting, the sessions, the agenda items, the interventions, and those interventions will be delivered by those people who are here in person. But clearly you're going to be listening to the debates as they occur virtually over the course of the week. This is not we don't want this to be a passive process. What we're very keen for people to listen out for are any mentions, of course, to nurses or nursing within the debates. And via the email group, via the WhatsApp group, if you hear nurses and nursing mentioned or referred to, please let us know, and which country or which person was making the intervention. The reason for that is that those of us who are here in Geneva, we have a whole series of bilateral meetings that are set up as well. So the president is going to be meeting with the nurses, the chief nurses who are on government delegations. We're going to be meeting with some of the other international organizations who are here as well. So knowing what is said in those main committee sessions, interventions that are made by countries where there's a specific mention to nursing or midwifery allows us then to follow that up within the bilateral meetings that we will be having. And even if we haven't got a bilateral meeting set up, if there's a country who makes either a very positive or a more challenging remark about the profession, we physically here then will go and find those people out and have the conversation and follow that up. So I just wanted to stress that there's that interaction between what you're doing virtually and what we are, what we're doing here in person. There are also a range of side events that take place during WHO. Those started on Friday, and those of us who are here physically are attending, and the president and I and Erica also have a number of speaking engagements as well, covering issues like NCDs, like surgery, UHC, workforce issues, of course. So over the next few days.
Trabajo que van a tener ustedes.
And the discussions, there are a set of bilateral meetings. There are also a whole range of side events as well, and we want to make sure that we're coordinated in sharing across all of those. There will be a daily communication update. So you'll hear what we've been doing, what's been said. Erica is your go-to person, along with WHA, for what happens in the main hall, for the main business meetings. But as I say, anything else that you might hear or you might pick up, or interest that you have in any of the side events or country-specific issues, share that through the WhatsApp and the email group as well, because we will be picking that up. The other reflection or piece of advice to share with you is that, as with all conferences, all big events like this, a lot of the decisions about the positions that people take and what they say may have been subject to discussions before the meeting starts, which can mean that within the meetings, often there's a lot of consensus. But one of the things that we've noticed over the last year in particular is that some countries have been bolder and have been more public about saying where they disagree on particular items or issues. If you're listening to a debate and you hear a public disagreement between countries within that debate, that's unusual historically. Perhaps it's becoming a little bit more typical. But again, please do let us know, because that's very, very, it's not just interesting, it's important for us to know globally where countries may not all be signed up to a particular approach on UHC, on NCDs, or on the workforce as well. The Director General had a speech yesterday. He's got another one in just a few minutes, in about 30 minutes time. The speech that he had yesterday is more of an introduction, and he recognises people who were awarded by WHO. For those of you who didn't see it, important to note that he spoke a lot about immunisation and vaccination. I was a little disappointed that he didn't talk about the people who deliver IMS and vax in that speech. A lot of what he said was very, very good, but he didn't talk so much about colleagues. There are some of you, please, we can hear you. Thanks very much.
Not about nursing.
Colleagues, there's some of you, just check if you're on mute, please. Thank you. So there are some, so there was his speech on immunisation and vaccination yesterday, but his speech in just a few minutes' time is really the speech where he frames the WHA for the next week. So we will be listening out for that as well, in terms of what his key messages are and the areas that he wants us to focus on. Colleagues, the other big event that we have on Wednesday is the ICN hosted luncheon. This is going to be both physical and virtual. I know that you all know about it. We would like and hope as many of you who can join that luncheon virtually do so. We've got a big TV screen, so people who are in the room will be able to see you all as well. This is an event where we welcome all of the nurses who are participating in WHA, along with the Friends of Nursing internationally who are here at WHA. So that's an important event if you're able to have in your diary. And the president met with Amelia, with our chief nursing officer on Friday to start preparations for this week, and Amelia will be with us on Wednesday at the luncheon as well. Final thing, just so that you know, we write, Erica and Hoishan write a very significant report at the end of WHA, which captures all of the interventions, issues that have come up, feedback, positions that people have taken. But again, the work that you do in supporting the delegation, what you hear and what you let us know, is crucially important to inform and feed into that report as well. Colleagues, thank you again. We do have a couple of questions that I saw. Erica, do you want to pick up? The first question was about the committee, the committee room. So I'll hand back to Erica to pick up the questions.
Yeah, thanks. So there's a question around difference between committee A, B, and round tables. So committee A really looks at the agenda items that we're interested in, put it plainly. Whereas committee B looks at some of the more technical agenda items, so budget, financing, WHO staffing. Sometimes what they have been known to do, however, is as the week progresses, they will flip over let's say an agenda item on NCDs, and they'll put it in committee B. So that's where it becomes a little bit important to follow on WhatsApp, to follow the journal, and we'll be communicating those updates as soon as we get them. And they do that because those two meetings happen concurrently. So it's a way of separating the agenda so that the meeting can proceed over a week and not over a month. And then the roundtables are more informal. They are set up typically by sometimes non-state actors, or there'll be 3 or 4 leading member states. So for example, the first one will be today at 1 p.m. Geneva time, and that's looking at a member state-led process to strengthen pandemic prevention, preparedness, and response. And there's just one each day. So it takes place usually over the lunchtime, and it's more of an informal exchange. Tomorrow, it's looking at the health and care workforce. It's an action-oriented agenda for the second half of the SDGs. So a really important one for us to participate in. And actually that brings me to another question that we had. Is there a specific session where HRH, Human Resources for Health, will be discussed? Historically, that has been an agenda item. There's not a specific agenda item this year. However, it is absolutely sprinkled through most agenda items, which is fantastic because there's a recognition that the healthcare workforce is important in all of these issues. So lots of mention of healthcare workers throughout a lot of the agenda items. Not a specific one, but then there's this roundtable tomorrow, 1 p.m. On the SDGs and the health and care workforce.
And for that roundtable, just so that colleagues know, but the president and I have been invited to attend that, and will be at that as well.
So the other questions, I think those are the only questions that we have. Is that right?
Yeah.
Human resources. Yeah, I think that. Yeah. So as Howard said, I'll be available on WhatsApp and over email. I will be sending daily updates at the end of each day, just as a summary of what happened throughout the day. So look out for those. And if there are no more questions in the chat, in about 15 minutes time, the WHO Director General will give his opening address. So for those of you who are awake right now, you should log into that. Okay.
So thanks very much, everybody. We will see you virtually, as many of you, we hope, for the luncheon on Wednesday, and look forward to seeing the chat on WhatsApp and on email well.
Ready.
Thank
you. Bye.
Thank you.